record this on the computer. Okay, I just wanted to introduce one of my favorite mentors and teachers, Dr. J. Dunn. And I have taken some classes from Dr. J, and she has blown my mind away with the things that can be done nutritionally for genetic tendencies. And without going into too much other stuff, I just wanted to ask you some questions, Dr. J, and let people who may not know you get to know you and some of your philosophy about health, some of the things you see and observe and the things you've learned, and just kind of pick your brain a little bit.
Yeah, sounds good. Thanks for inviting me on your little show.
Yes. Well, I wanted you to just take a minute, maybe just to give like a little brief. Who are you? What are you still in practice? Kind of what's your thing that you're interested in? What do you do?
Oh, well, that's a big question.
Yes.
I'm not currently practicing. I kind of took I just sort of left my practice in New Mexico essentially and sort of devoted myself to this work on studying genetics and genetic variants and how they affect the physiology and how they affect the biochemistry of the body and lead to disease processes. After I discovered that, oh my, this is a big topic and it's really important and it is groundbreaking and it's making some huge inroads into people's health. So I figured, this is the time I'm gonna jump in and just do this work and start spreading it out to the world. So that's
So
what
is your work now more like spreading the word to teachers to kind of influence the doctors rather than try to do like a one person affect as many patients as you can get your hands on, instead affect doctors instead?
Well, yes and no. Greg, my partner, and I were sitting on the porch one day and we were talking about that. We were like, gosh, I'm one person and I can only help so many people. And holistic or kinesiologists, who are my favorite people in the whole world, are a small fraction of what's out there in the world, but I think they're the best people on the planet for helping get health back. Yeah, go Lewis. But then I thought, well, we started saying, well, how can we help many, many more people? Because this is important work.
Yeah.
And we decided to develop a software program that would do, pretty much what we're doing with muscle testing, as close as we could get without muscle testing, doing it with a software algorithm so that we can help more people. So we have started that and it's in progress. It's in process now, the My Happy Genes program that can help a lot more people, lay people.
No, I was going to ask a kind of a question about a little bit more. So that could have been something we could have talked about at the last, but I wanted to, since you already mentioned it, if someone is kind of wanting to say, hey, what is this Happy Genes thing? How do I do that? Can you give like a little bit more about that?
Yeah, sure. It's if you go to myhappygenes.com, all one word, you can take a look at what we're doing. But essentially, we're doing, we're analyzing genetic variants, and then we're giving you kind of your risk of certain brain chemistry imbalances. That was really, because we saw such incredible results with brain chemistry issues. That's like one of the first things. And even you said something about it. You and your wife said it was like marriage counseling in a bottle or something.
Yes, it was like, hey, we're both happy. Why should we argue or be snippy with people, with each other if we're just feeling awesome? So that's what we felt after we got, during your class, we got checked and started taking some of the things that balanced us. And yeah, that was how I felt. It was like, feel great.
Yeah. And me too. That was the first thing I noticed when I started doing, getting my genes tested and getting it balanced using nutrition. Was, my lifelong depression was gone. It was just gone, and I think I felt happy for the first time in my life. And so I wanted to bring that aspect to the world, but it does so much more than that. And in fact, we designed it also for practitioners because we wanted the practitioners to kind of oversee the supplement part of this because it's so powerful. I didn't want to just put, supplements in the hands of people who don't understand what they're doing with them. Because it can change your brain chemistry, and sometimes if they're on antidepressants or they're on other medications, it can interfere. So I wanted to make sure that they were under the care of somebody like you, that
yeah. Well, can you expound a little bit on say hey, I'm going to get some care for nutritionally supporting my own genetic variation needs. And you kind of alluded just there to that brain chemistry seems to be one of the first and most powerful things that you feel shifting.
Yeah.
But what are some other things that you see? There's probably hundreds of other things that it affects, like the immune system or allergies. Can you kind of explain a few of the other things that you see that also benefit?
Yeah, one of the genes that I first started working on for myself was called the vitamin D receptor, and I'm sure you're well familiar with that. But I was always getting colds and flus and things like that. But what I found was that genetic variants in that vitamin D receptor can very much affect your immune system, how your T cells respond to an infection of some kind. So, those people that are chronically, they're always getting the colds and flus or viruses, bacterias, whatever's going around, you can spot them right away and go, oh, they've probably got a genetic variant in that vitamin D receptor.
Yeah.
And once we upregulated that, not only did it change my immune system, but that was the gene that also upregulated my brain chemistry. At the same time, it did both. So many of the genes that we're looking at, can affect your immune system, especially autoimmune conditions as well. Energy production pathways, how well you make energy out of your food, and how much, how your weight is, how you your metabolism is, how fast you can burn your fuel. Essentially, that's genetically inherited as well. Your ability to detox, how well you can detox, is genetically inherited. So we look at the genes for that.
Yeah. So that would probably be something helpful for like some of my favorite patients come in with like these vague things. Like I heard all over, I've been told I have like fibromyalgia, which who knows what the cause of that is. That's like getting down to like this is some of the causes of it.
Yeah, absolutely. I was talking about that this weekend because we did the intensive, and I was talking about the 7 levels of why.
Mhm.
If you go into your medical doctor and you say, I have arthritis or my joints hurt, and he'll go, oh, you have arthritis, here's a prescription for that.
Yeah.
That's one level of why. It's because you had a drug deficiency or something.
Mhm.
The next why down, that's where functional medicine people look at, oh, well, it could be something you're eating, or a deep-seated infection, or a toxicity or something causing that. And so they sort of address it right there. But then we go, well, why are you toxic? It could be, yeah, something in your environment, yeah, something you're doing, something you're eating, but it can also be a genetic variant there that is causing you not to be able to detox correctly, or causing your immune system to overreact to your joints. And then we ask, well, why? Why is that happening? And so we go 7 levels deep, a lot deeper than anybody out there is really going, and to understand that real root cause. We thought we had it. We thought we had it with, like, oh, it's a virus, or it's a toxin,
Yeah.
or change your diet. It's deeper than that. It's like, nope, there's that genetic variant. And if you give the body what it needs to do the job, it'll do it itself. And so it seems like magic, because the arthritis disappears when you take the exact right nutrient for that gene that's causing it. So
So having your own genetic, like a few weak pieces, so to speak, in your genetics, it's not like it's not hopeless. Something can be,
oh,
even though you think it's
yeah.
genetic, you can't change your genetics, but you can support it and kind of really make some powerful changes.
Yeah, absolutely. And that's the thing, because a lot of my patients were saying, well, I don't really want to know if I've got the risk of Alzheimer's or, Parkinson's. I don't want to know. And it's like,
Mhm.
wow, there's so much you can do about it. It doesn't mean it's written in stone. Your genes can't change. I mean, your genes are your genes, but the expression of those genes can change. And that's what we call epigenetics.
Mhm.
And they change with, diet, lifestyle, supplementation, emotional work, chiropractic work.
Mhm.
Those can change the expression of genes, and change the outcome. Rather than going down the road to Alzheimer's, you can definitely head that one off at the pass, and
That's
keep that from
so encouraging. That's not what we are kind of taught.
No, no. Well, I think that's why I say it's sort of groundbreaking, because, it's only recently that we've been able to get in there and understand what our genes do. The Genome Project was only finished in like 2006. So just mapping out the genes is a very new science, but then
Yeah.
understanding what it means when you inherit a genetic variant to your physiology is very, very new. But it's incredible the results we're getting with everything. I don't know about you, Lewis. Are you seeing incredible results in your practice with?
Yes, in general, I'm much more newer to this and at a newer level, but growing every month with practice, but seeing really nice stuff, especially like the people who are like, oh, I have to really have a strict diet. I can hardly eat anything. I'm seeing people like, no, I can almost eat everything now. Look, there's some things they kind of have to cut, not push it too much, but it greatly allows them to start eating like normal again. Or hey, I'm not sick again and again and again and again. I was probably working on that first rung down, like, oh, you have a virus, here, take this herb. And now it's more like you may need the herb or may not, and then you're not getting sick seasonally and again and again. It just seems like that's kind of handled. And so it's much like, rather than just putting out fires that keep popping up, it's more like, hey, you're stable, which is what I want for me and I want for my patients.
Yeah, very much so. And that was the interesting thing is, I had these chronic patients, the patients that are like, oh, now it's this thing and now it's this thing. Now it's, it was like whack-a-mole.
Yeah. It's this
And
today.
then what's that?
It's this today. And
Yeah.
yes.
And you kind of cringe when you see them coming in because it's like, oh, I feel like I'm not getting to something,
Yeah.
I feel like I'm not helping them as much as I want to help them.
Yeah.
Not because they're bad people, but because it's frustrating for both, like,
yeah.
Oh, it's one thing. But that was the thing I was finding is, they would come back in after we did a program on them with the genetic information and the methylation. They'd come back in and they'd say, I'd say, how you doing? And they'd say, good. And I'm like, what do you mean good? You're never good. You're good? Yeah, I feel good. Good energy. And I'm like, okay, digestion's okay. Yeah. Does anything hurt? No. Sleeping? Yeah. Oh, okay. No headaches, no nothing?
Mm-hmm.
No. I'm like, wow,
weird.
This is weird.
Yeah.
And then you can move them out to a month and just double check.
Yeah.
And, may need a little tweaking, but for the most part, they're stable, like you say.
Yeah.
And then they go out 6 months and they're super happy because they're like,
Yeah.
wow, this is what it's like to be normal and not have to deal with my health all the time. And it was such an incredible gift, to see those people going, yes, I feel good.
That made me think of just a question that I have and maybe other patients have. And that's kind of the question of like, some of the active forms of the B vitamins. And I explain a little bit about this sometimes. Some people need the active form and blah, blah, blah. And so what would you answer? I know my own answer, but what would you answer to someone that says, why can't I just take a multi with all the good stuff in it and the active forms? Shouldn't that handle it?
Yeah, you would think so. Yeah. And I do get that question a lot too. But a lot of times there are things that are going to push a pathway, a biochemical pathway, the wrong direction. So if you have B6 in there and they've got a CBS gene, they're going to overmethylate, or they're going to upregulate, a different area of the pathway. So when we design a multiple for them, it's going to be very specific. They can't do B6, but they can do B1. You never see a formula that's only B1 without the B6, a B complex blend that doesn't have the B6 in it,
Yeah.
So it's very precise.
Yes. I rarely find multis test good on people.
No, it's just very, very rare. There's always too much of this and not enough of that. To get that one multiple, it's going to take 1 in a million persons. That's going to be its exact form. And it's not like you just take minerals, you take vitamins and they just flush out. That doesn't necessarily happen. You're doing something to the body, especially if they're any good, if they have any active ingredients at all. They're doing things to the body that you don't know. They're upregulating different pathways, and you might start to get headaches and not even realize that it was your multiple vitamin that you're taking, and you might think, oh, something.
I think
so
it's just mind-blowing, this stuff. I was excited. Well, I have to share when I went to your class the first time and you just put up that thing of like all the circles of the different pathways, I almost passed out or threw up because I was like, Oh my goodness, this is microchemistry. I forgot all this, and she's talking about the Krebs cycle, and I started to see gray, and then I kind of came back, and then I said, okay, just do one thing at a time. But I thought it was just the coolest thing where some people don't do well with B12, like standard B12, and you're like, stay away from B12. You need methyl B12. And it's like, wow, that's so cool, and kind of opened my eyes a little bit as as the class went on. But I think that's so. I tell some patients, don't take anything with regular B12. Look how it affects you. Like,
Yeah.
here's a bunch of stuff you can't handle.
Yeah, it is kind of eye-opening.
Um, I wanted to I wanted to ask another question. Like, I was thinking, once you get somebody pretty stable, like the genetics don't shift, but the epigenetics might. Like, might you see something shift if you got someone feeling good and then they just decided to say, you know what, I'm feeling so good, I really want to start exercising and
Mhm.
start eating really healthy. Might that shift the amount of support you need or change
Yes.
things just a bit?
Yeah, very much so. Yeah, if you go from eating a no nutrient diet to having nutrients in there, it will affect things. Yeah. And with the new My Happy Genes program too, we give you a diet and lifestyle report that shows, oh, you do better on carbs or fats or proteins. It gives you the best ratio for you genetically. So when you start eating in congruence with your genetics, then yeah, you need less supplements. The more you're off track with your diet genetically, the more you're going to need like supplemental support. It isn't 100%, but it does make a big difference. Yeah.
Cool.
And
Oh, go ahead. Go ahead.
well, one thing, I don't think you've been there lately for the class, but have you kept up to date on the electron transport information that we kind of
Probably not. I'm
been
just
looking?
starting kind of the basic class again, running through everything. And so I have still some stuff to learn and catch up on. And to do the Happy Genes thing, my most favorite patient is myself. So I'm going to want to do myself in arena and get us done, because that sounds exciting. The idea of having a little bit of guidance towards what macronutrient ratios are kind of best. Because I know some people
Yeah.
do very well with vegetarian, and some people don't. Some people like don't feel
Yes.
well,
Yeah.
and some people feel good eating high fat, and other people don't. And that's nice to have a little direction.
Yeah, it's so true. The keto diet is so popular right now. But it's not for everybody. I look at some of their genetics and I go, "Oh, are you crazy? You're gonna explode your gallbladder there." So,
Yes, I think the people that make the thing, whatever the fat is popular, is the people that it helped, and then they say
no,
it's
that's true.
awesome. And then people think, well, it's good for me, but like maybe not. There's a lot of people that tried that thing and it didn't work for them. But you hear the people saying
Right.
it worked for me.
Right. Yeah, we're such a one size fits all. We try to fit all humans into one size multivitamin Centrum. Nah,
Okay.
everybody should eat whatever, diet. It's like,
Yes.
no, it doesn't work that way. I'm
Yeah.
shocked, because I've been running a lot of reports lately, and I'm just amazed at the variation of diets. Like for me, I always thought high protein, low carb was my best diet
Yeah.
because I read the Protein Power Diet many years ago, and I thought it made sense to me. But
Yeah.
when I looked at my genetics, it's actually the opposite. I do better on carbs and worse on fats and proteins. So like not donuts every day, of course, but like complex carbs. That's my best diet. And since I switched to that, I do feel a lot better.
So do you
So
feel
it's like,
better and less needing of supplements? Kind of a little
yeah, very much so.
cool.
Yeah.
I like less is better if it's the correct.
Yeah. I mean, we're getting, when you first took the class, I think we were at like 12 average, 12 supplements.
Mhm.
And it's really come down to now it's about 5 to 6 supplements on
Cool.
average for a patient.
That
And part of that is getting the electron transport chain and the Krebs cycle working. And that is your energy production
mhm.
part of it. A lot of it can be damaged, and it's damaged by the environment. So it's damaged by heavy metals, chemicals, pesticides, electromagnetic fields,
Mhm.
antibiotics, that kind of thing. But you can actually repair it. And once you repair it, it fires up a lot of those other genes that we've been looking at, and you don't need as much supplements for those. So it actually, does that make sense?
Yeah. Yeah. Cool.
Because each one of those genetic variants require ATP,
Hmm.
a cofactor, like a nutrient cofactor or coenzyme, and methylation. And so if you just bump up the ATP production, then sometimes you don't need the supplementation if you get that fixed.
Yeah.
So
I like that. I kind of think of the metaphor of like getting the engine that drives everything kind of going a little stronger, then little
yes,
processes start working better.
exactly.
Um, can you tell? I remember a story you told about a guy that came in a wheelchair one time who was extremely grumpy. Could you share that story again?
Yeah. He had MS, and he was a doctor friend of mine. And I hadn't seen him in over a year, and I was like, oh, I was shocked to see him in a wheelchair, and I was like, dude, what happened? And his wife was wheeling him in the wheelchair, wheeling him into the room, and hit the door jamb coming in, and he turned around and he just ripped her,
Hmm.
like, watch where you're going, and rah, 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 rah. And she's doing this, and I'm doing that, uh and anyway, so I thought to myself, well, crap, I mean, she's your wife and she's taking care of you, and you're going downhill. I think I'd be pretty nice to her if I were you, because
Yeah.
she's going to be your caretaker going forward. But anyway, I did the genetic report on him, and we found some of the warrior gene, the MAO gene, that kind of makes you grumpy. And we put him on a program. And next time they came in, she wheels him in the wheelchair. She didn't hit the door jamb, but she wheels him in and sets him in the middle of the room. And he turns around and he says, "Thank you, hon."
Hmm.
And I was like, "What is a different guy?" And he was
Yeah.
just totally different. He was just chill and sweet. And it was just in the beginning when we were doing methylation. I kept seeing this personality shift in people. And I was like, that's cool. That's pretty cool. But
The,
he got up out of the wheelchair after a couple of visits. He got out of the wheelchair and got on my table, and I asked him, how are you doing? Are you doing any better? And he's like, no, about the same.
yeah.
And the wife's behind him going, it's funny how patients sometimes don't see it or recognize
It's
it or want to
maybe
admit.
slow, or yeah, we see the change. Like you haven't seen some kid for a while and they grew 12 inches, but the kids can't see it, but you can.
Yeah. Or, it's funny because they often blame people around them. I said, you seem a little less irritable. He says, yeah, people are pissing me off less. I don't know. They're being nicer to me or something. They never think it's them. It's always like
Yeah.
everybody around them has changed. Everybody around them changed.
Everybody's becoming less stupid.
Right. Exactly. That's amazing.
Yes, you're changing the world through this one person. The whole world intelligence is raising up. Uh,
Exactly.
that is so awesome. I'll often have people come in. This is not genetic, but I'll see people come in and I'll work on something that's kind of what I think is an important main thing. And
Mhm.
and they listed like 20 things wrong with them. And then a follow-up visit, and I'll say, "Are you feeling better?" And they're like, "Not really." And I'll go through their 20 symptoms again, and they say, "Well, no, that's better. That's better. That's better. This is still bothering." So they'll have 10 things that got better, but there's still 10 things that need some resolution. But they're like, "No, I'm not better." But they're
Yeah. Isn't that
50%
funny?
better. They're like, they want perfection in one visit.
Yeah. Or they just forget, it's like,
Yeah.
"Well, how are those headaches?" I didn't have headaches. I'm like, I wrote it down.
Yeah.
You're having
Yeah.
headaches twice a week. Any headaches? Oh, I guess that is better. Yeah. So it's funny, a little global amnesia there or something.
Yeah. You focus. Like I still get these little hangnails that are like really annoying. They get smaller complaints.
It's so true. My hangnails aren't any better. I don't know. You're not doing me any good.
Yes. Yes. Let me think of one of, I'm peeking over at my cheat sheet for questions for you. Um,
Okay.
when you were in practice in Albuquerque, correct?
Yes.
Um, that's where I went to high school, by the way.
Oh, it is. Where'd you go?
I went to Manzano.
That's where my daughter went to high school.
Oh, small world.
Oh, wow.
I would ride my bicycle back home every day over the street, go back up to the foothills.
Oh,
Um,
okay.
but when you were in practice, or maybe even still, what are some of the most common things that people would walk in the door saying, "Help me"? Like, what did you tend to attract? Like the complaints?
The complicated ones, the ones that are allergic to all the different foods, or just the mysterious diseases that nobody could fix,
Mhm.
or their blood work's fine, but they feel terrible. Fatigue it was a biggie.
Yeah.
Yeah, headaches is a biggie. I was a musculoskeletal practitioner, so I didn't attract a lot of low back or joint problems. That wasn't my thing. But
Yeah.
yeah, the mysterious diseases, I'd say, were the ones
And then you get people better and they like, I've been to 20 doctors. You finally fixed me.
Yes,
And they talk about you.
right. Yeah, for sure. I remember the first one that I did the methylation on was a little boy who was 11 years old, and he had chronic regional pain syndrome. And what that means is doctors can't figure it out. So, really chronic regional pain syndrome. I hurt is basically what that means.
That's
It's like what
Latin
they could
for,
have diagnosed on it.
yes.
Yeah. And he'd been to 40 doctors, 40, and
Whoa.
no exaggeration. And he came in and he had been in a wheelchair and hadn't been able to go to school. He was a gifted child though, super smart. And I started doing, I said, hey, when I first found on him was Lyme disease.
Mm-hmm.
And I said, have you been tested for Lyme? And his parents said, no. And in fact, we just moved here from outside of Lyme, Connecticut. And I said, did you happen to see a bullseye rash on him anywhere? And they were like, yes. I said, nobody tested him for Lyme.
Wow.
Nope. Out of the 40 doctors. But anyway, he did have Lyme. But I said, are you interested in doing this? I'm doing this genetic thing. Can we do this on you? And we did it on him. And within he was one of those cases where he could only eat like 2 foods. If he had anything other than those 2 foods, the pain got so severe, that he could hardly stand it. And so, when I tested him, I also said, well, you have leaky gut, you got this and this going on. And that's how I was practicing at that time was let's work on leaky gut. Let's work on the food allergies. Look at the gut flora, look at this and that. But I said, let's do this methylation thing. And I started the process on him. And I didn't address the leaky gut at that time. But when he came back a month later, the leaky gut was gone. And I was like, this is really weird. You're not testing weak on any of the foods, and the leaky gut reflexes were clear. Mm-hmm. And I said, go ahead and try some foods. And he came in the next time and he was like, yeah, I can eat anything I want. It's gone. And I was shocked because it was like, wait, I'm used to micromanaging the gut. We got to do this and we got to do this. And it's going to take a long time and you got to do it. Yeah. But it was gone. And I was like, oh, wow. I don't know what I just did. Let's find out. And so I had to tear this thing apart and figure out how I just fixed leaky gut without fixing leaky gut. And that really intrigued me, and he just got better and better. And of course, went back to school. He's in college now. And awesome. Actually, he's coming down in a couple of weeks. He's coming down to visit from Albuquerque. But
nice.
Yeah, we
got
those. Him.
Yeah, are there some story or some patients where as much as you can do, they still kind of need to keep a certain food low? Or have you found that when you support particular genes correctly, they just can pretty much eat anything?
I think it's really a combo. I think I've softened on that over the years. I used to say, well, you can take enough supplements to where you can eat anything you want, but it's a lot of supplements sometimes. And I think it's a better thing to just stay low on dairy. For me is not my best friend. I can have it sometimes, but probably shouldn't eat a lot of it, and some people gluten is, something that they should avoid, or other people alcohol or coffee, or, I think I'm a big believer in enjoying your life, enjoying your food and having a good time. And having balance there. So, but I also believe that, sometimes some foods are just not going to be fun.
It makes you need so much support. It might kind of be more worth it to.
Right. Yeah. So I think the combination of staying low on that and then doing the supplementation to help prevent adverse effects from it, that's a happy medium for most people. It's yeah.
Do you see in your practice or experience much with people kind of weaning off their prescription drugs as they get healthier? Is that pretty common? Or
yeah, very much so. Yeah, it depends on how open they are to that. Some people are like, well, I don't ever want to stop taking that drug. The medical doctor convinced them that statins are a good thing. It's like, no. But other people were working on their blood pressure, and their blood pressure drops dramatically low. And I tell them, stay in touch with your medical doctor because your blood pressure is going to start dropping. And so watch it, just monitor it, or blood sugar, or
Yeah,
pain medication for sure, or antidepressants. I've seen them all. That happen for all of those things. Insulin, I've seen it drop. So
that's
um,
so cool. I wanted to ask another question. Do you see that balancing the genetics seems to help any with addictions?
very much so. And that was really exciting to me too. One of the first cases I saw was a methamphetamine addict.
Uh-huh.
And I didn't know this was going to work. You know, her aunt brought her in, and she was a young mother. She had 2 little children at home, and she was routinely leaving them for a week at a time and going off to these meth houses or whatever. And you know, they'd call their aunt and say, "Mom's gone again. Can you come and get us?" You know, and she'd show up in a week or so and swear she'd never do it again. And you know how that goes with meth addicts. They mean well, but it's so powerful. And so they brought her in and said, "Can you do anything with this?" And I said, "I don't know. I'm doing this new genetic thing. I'm doing this methylation and blah, blah, blah." And we put her on a program. And within a very short time, she said, "I don't have any cravings." And we all went, that's nice. We'll see.
We'll see how long
And
this is.
and then it went on for like a year. As long as she took her supplements, no cravings. She didn't drop into methamphetamine use. And then she ran out of her supplements, stopped taking them, and she went right back to the meth use. And then her family called me and said, put her on automatic, supplement list.
Automatic
Don't
ship.
let her run out. We'll pay. Automatic shipment. Don't let her run out. We'll pay. And it's been 5-6 years now, and she's been free of methamphetamine addiction. And then I did the same thing with a heroin addict. I've seen it happen with alcohol. I've seen it happen with cigarettes. I've seen it happen with gambling. So I think it's very powerful. What we're doing is we're flooding the brain with dopamine, and that's usually, it's dopamine missing that is the big culprit with the majority of addictions, is
So you
low
just kind of,
dopamine. So,
your happiness level kind of.
yeah, your contentment. And so you're not looking for that dopamine hit in your addictive substance. And once your brain is flooded with dopamine, and that's workaholism too, for those of us who are workaholics,
Yeah.
it can work as well.
Yeah, cool. I know there's like that's very cool. There's so many different things out. I've noticed that in the foods and stuff that you can buy, a lot of the things that tend to come to the front are the addictive things, because they're addictive. Because like these seem to be quite popular in the food store, or or the cigarette store, or alcohol, like, because they're addictive. That's why they're getting quite popular. And then some of the things that are like, that's kind of boring, it's not addictive.
Yeah, vegetables are in the back.
Right. Yes. Could you touch a little bit on how the genetics can supporting the genes can affect weight? Because I know that's just a big thing for a lot of my patients who are struggling.
Yeah. Do you mind if I share a screen? Can I?
Go ahead. Yeah.
Okay. Let me. I don't want to overwhelm everybody with biochemistry, but can you enable screen sharing for me?
Oh,
yeah. But I think they can do it.
Come on.
I'll make it pretty simple and easy to understand.
See, advanced one. I'm just going to see if that doesn't enable your screen sharing. Does it work now?
Yeah, that's it. Let me just close that. And I'm going to go to the interactive program here. So this is that biochemical pathway that you said you almost passed out when I showed
it. I did feel kind of faint, yes.
I don't blame you. I did too when I first started looking at this again. I was like, I hate biochemistry, but now I love it. It's so cool.
Yeah.
So this is the pathway here, the citric acid cycle, Krebs cycle, however you want to call it, where we take in food, and all our food is eventually turned into glucose. And then we go, create pyruvate from that and acetyl-CoA, and then go through these pathways. And the bottom line is we're going to make energy out of our food. That's what we want to do. So these purple balloons here are genetics, are genes, or sorry, they're enzymes that are coded by your genes. So if you have inherited a genetic variant in those, and especially the dark purple ones, they're going to prevent you from turning your food into energy. And so that will cause you to have low energy and gain weight. And some of them, like this one over here, you can see, if you have a block there, you're going to make higher cholesterol. And that can lead to gallbladder issues and cardiovascular issues, but it will cause weight gain as well. And again, anything down here, like these three, will cause you to not be able to make energy efficiently. So we ask, well, why is that in our genome? It's not a mistake. This is not a mutation. It's a variation.
Mm-hmm.
And so somewhere along the line, your ancestors benefited from being able to hold on to weight better. And that's, during times of starvation, it was an advantage to be able to store your energy as fat rather than use it as a fuel. So those often people inherit those genes and are stuck with a low metabolism, and they say they inherited, those. Sure enough, that's very real. But there's a lot you can do to work with these genes to upregulate them, get them working faster so that you can break down your food into energy better. So we're finding that, very much it'll increase your energy so that you want to exercise. A lot of times these people can't exercise because they just don't have fuel in the tank.
Mm-hmm.
Their body isn't making fuel.
Yeah.
And everybody says, get out there and exercise. What's the matter with you? Just do it. Well, they can't. They feel terrible when they exercise. They're tired. It makes them more tired, and it wrecks them for a day or two. And I was one of those people. I had some mitochondrial damage, and sure enough, whenever I'd exercise, it set me back a couple of days. I couldn't really function well, and it was frustrating because I know the value of exercise.
Mm-hmm.
Nobody doesn't know that, do they? Is there anybody on the planet that doesn't know that exercise is good for them?
I think
there are some people.
A guy named Fred that doesn't know about it, but
Fred.
Other than Fred,
yeah, we need to call him. I'm going to call that dude.
Knows about it. Yes.
But it's very difficult. And the same token, these people also are going to reach for glucose as a fuel because they're not burning their fat as a fuel.
Yeah.
They're storing it. So they're eating, high carbohydrate diets, and we tell them, stop eating the sugar. When they're like, yeah. Is there anybody that doesn't know that sugar is bad for them? Maybe Fred. I don't know.
The only thing that makes them feel okay sometimes.
Right. It's the only thing that's going to increase their fuel. So once we upregulate this pathway and get it going, they stop craving sugar. They stop even wanting it, and their bodies want to move and they want to exercise. So your diet and lifestyle prescriptions make more sense to them, and they can do it. They can follow through with it and lose weight. So it's not like instant weight loss. What it is it stops them, again, craving sugar, craving carbohydrates, and it gets their fat burning going, and then they can exercise. So
they probably feel a little bit more like satiety. I'm full or feel good, yes. Not so hungry.
100%. Yeah. The first person I had this happen to was, she was obese. She flew down from New York to see me to New Mexico.
Yeah.
And she had to buy 2 seats because she was so big. And I knew she was eating wrong. I mean, we all knew there wasn't a big secret.
Yeah.
But she never mentioned it. And, I'd talk to her about her diet and stuff. But then once I put her on a methylation protocol, she came back, she called me back, and she was crying. And she said, it wasn't my fault. I don't want sugar anymore. And I understand why now. And I've been eating, she said, I would eat a pack of Oreos a day at night. I would binge on them because I couldn't not.
Yeah.
My brain was like, give me sugar.
Yeah.
And she was crying because she's like, I don't want it anymore. And it wasn't my fault. I've been beating myself up for being, having no willpower. So it was like, that was an eye opener for a lot of people.
Yeah, that's kind of hard to fight a biochemistry imbalance. You're like, don't be hungry.
Don't be hungry.
I'm hungry.
Don't take that cigarette. Don't take that drink. Don't take that drug. We do that. And then we beat ourselves up for having low willpower and thinking that other people have more willpower. It's just not that way at all. If we look at it as a symptom, not a cause. You know?
That's so cool. I hope this is encouraging a lot of people. I wanted to ask another just question along my list of questions is, let's say somebody comes in with a couple of complaints. What's your time frame for seeing people generally start to feel different? Can it be quite quick, or is it like, it takes a couple of months to kind of feel better? What's usually you see?
No, It's very quick. Some people say the minute the first dose, they felt it. Other people, it might take a week, and especially in the brain chemistry areas and the memory, the word recall will come back pretty quickly. Yeah, from 1 day to 2 weeks, they're definitely going to feel a change. If you've got that program dialed in exactly right,
Yeah,
they will feel it. They will feel it very quickly. Yeah.
that's
Now, chronic diseases, they're going to take longer to heal up, but they will start to feel like, I think I'm moving in the right direction. Like an MS patient might say, yeah, I got some more mobility in my legs. My gait feels better, or my energy feels better, or,
yeah.
it's not like you fixed MS in a week. That's not going to happen.
Yeah, but you feel
Um,
like my hardest thing in my job is people coming in who are kind of like, I'll even try you, weird guy. Help me. And so my job is to try to give them some hope that try this. And if you start to feel better, then you have some hope. You don't have to feel perfect, but like some gains where you've had none from all these other doctors, then you trust the process and you'll hang in there. So I'm like, let's get you to the point where you're feeling some shift. And
right.
sometimes people are like, my patience is like right here, almost, you get one chance because I'm just been to seeing 20 doctors
Yeah.
um, and so getting people feeling that shift is my biggest happiness when they feel it. I'm like, good, then let's keep going. Let's keep
Yeah.
pushing.
That's so fun. I know you signed up for the right reasons. You really want to help people, and
Yeah,
we get a little dopamine hit from somebody coming back in and saying, "I feel better."
yeah. I'm like, yeah, do the little happy dance because I haven't seen you in 6 months because you come in for a recheck and you're like, because I don't feel bad. And that's like, I feel awesome. Um,
Yeah, that is
uh,
exciting.
yeah. One other question. Um, well, if someone's like, I know some people are saying, I love vaccines, and other people are like, no, I don't trust vaccines, and all this in between. Is there some way, I think you mentioned during a class one time that if you want to avoid having to take a vaccine, getting genetic tested might show a reason why. Could you explain that?
Yeah, there's a website called MTHFR support .com where you can go, and if you've got 23andMe or Ancestry DNA results, you can put it through their algorithm, and it's a excipient report,
Hmm.
and it'll show you, your ability or inability to clear the excipients that are in vaccines. So for some people, they're taking it into their doctor and they're saying, look, I've got all these genetic variants. I think I'm going to have a bad time with vaccines. And in some cases, that's getting them a medical exemption.
Cool. I
So it's
remember,
worth trying.
yeah, I remember that is one thing that you mentioned. Uh, um, Let me ask a little bit. I'm very much more a muscle tester, applied kinesiology, brain biofeedback guy, and I'm kind of being pulled kicking and screaming by you into the blood testing. And then other people are probably like, oh, I don't do muscle testing. I'm a lab report guy or gal. Um, what are kind of the advantages or disadvantage of each one? What would you recommend to somebody who's just, I'm just watching this video. What do I do? How do I get started? Who do I
Are
look
you talking
for?
about a practitioner or
Uh,
a patient?
like a patient who's saying, I want to get some genetic testing. I want to do some of this stuff. Should I start with doing a genetic test? Should I just go find a doctor and do some, do some applied kinesiology approach, or both? Or what do I do? Where do I get started?
I'm a big fan of both. I think that kinesiology is the top of the line of information gathering tool
Mhm.
that you can get. And but I'm kind of biased. I've been doing it for 32 years.
Mhm.
Uh, and I see it just heads and tails above any other modality as for finding information about the body. But I like to back it up with some objective testing. So I like to see that genetic, and I think patients do too. They like to look at, oh, that's why I'm taking that supplement. I
Yeah.
see, because I have a genetic variant that's associated with cardiovascular disease. I'm motivated because their cardiovascular disease runs in my family, is down
Yeah.
my line. I'm going to take that supplement because I can see why now. So sometimes they need more than just, you know, pushing on the arm and saying, this is what you need to take. They need that objective data to say,
And
yeah, this is
and
in your genes.
hasn't the prices of the genetic testing been coming down a lot over time?
It has, you know, 23andMe and Ancestry are pretty cheap, but they also are lacking quite a bit of information. When we put together My Happy Genes, we're looking at about 500 genes, and they're missing about 200 of those, 200 to 250, depending on which one you use. But so the correctness of the data is a bit missing, and so
So
yeah,
it's just
cheap.
it's like a shorter report than you want. There's some things you would like to have more.
Yeah, very much so. You know, they're aimed at ancestry, you know,
Where you
looking at where
from?
you came from.
Yeah.
Yeah. And how well do you metabolize drugs?
Mm-hmm.
You know why, right? Because they're selling their data to drug companies. That's why. So all
Okay.
they care about are the genes that are associated with how well you metabolize a drug. So that's where they got all the money. I mean, 23andMe, they were selling their genetic data for very cheap because, you know, they were collecting data and then they sold your data.
So
So
would they be interested? This is a random question. Would they be interested in like the data on you, or would they be interested in the conglomerate data for, say, the U.S. or both?
well, probably both. Yeah, they're looking at different individuals, and you know, you had the option to take the survey or not, and then you can put in, yeah, I have MS, and then they look at, oh, well, you have this gene too, so they, you know, they tabulate that kind of thing, and it's probably good in the long run. It's good data and good research,
Mm-hmm.
but your privacy is lost, and you never know where that's going to end up. You know, whether it's going to end up in a, you know, insurance company saying you're denied coverage because you have a gene for blah.
Yeah.
It's a little scary. You know, you don't know where that's going to
Yeah.
go.
It would be weird. I don't know if it's going this way or not, but it would be kind of weird to like say, I want to work at this company, and the company says, we're not going to hire you because you're probably going to have a higher insurance need. We're going to go with this other option because they seem to be healthier type of individual and won't need so much insurance care. Probably will show up to work a little bit more regularly, not have addictions. You can
Well,
just go
they'll
find.
never be able to say that out loud, but
But
that's
for
discrimination. But who knows what they're looking at? You know, they
yeah,
could. So that's why, you know, with our DNA testing, we decided privacy was of utmost importance. And so when we do our test kit, well, so this is our DNA kit.
yeah,
It's registered only by a barcode. Can you see that?
I can.
Upside down. So that is the only identifying information that goes to the lab. Your name will never be on it. No identifying information other than that number.
Yeah,
And then they destroy the sample after 30 days. So boom.
very cool. I enjoy privacy myself. I don't
I
mind.
think yeah, I'm not paranoid, but I think it's a good idea to, you know, trust in God, but tether your camel. You know what I mean?
I like that metaphor. I haven't heard that one. Yes. Carry an umbrella if it looks like it might rain.
True, true,
What
true.
what another random just little question. What is your most fun part of your job? And then on the flip side, what is the most challenging part of your job?
Oh, those are good questions, Lewis. The most fun, I really have to say, you know, this weekend we had the the intensive seminar where we
Mhm.
had practitioners, the best of the best, came down, and it ends up being more like a think tank. You know, it's a sharing of information. I learned a lot, and everybody there learned a lot, and we just tested each other. We took care of each other, and
Mhm.
it was the best. And that just really fills up my cup. And to hear the stories of the people that they're helping, and the changes that they're seeing in their patient, and that just makes me so happy. So that is the best part, to see the practitioners getting so excited and being successful in their practices, and getting themselves healed too.
Yeah.
And then the most challenging is dealing with just the software. Just like all the intricacies of the software and the logistics and the getting this going and that going. And so I'm handing a lot of that off to my partner and saying, you handle that. But I like the research part and the working with practitioners part. So
Yeah,
that's it.
I'm not much of a software person. I like it when it's like very much click the giant green button, or
Yes.
like the easy software stuff, and it's not always easy.
No, it's a little bit frustrating, but and waiting. You know, I want things done now. You know,
Yeah,
dear
yeah.
God, give me patience and give it to me now.
Now,
Oh,
yes, yes. That's I've run out of questions, Dr. J. I could pester you with more, but I just enjoy hearing kind of what people are about, and and it's nice to be able to speak with you. I've been watching you on your recordings and
okay.
refreshing my memory with class redo, and I'm appreciating being able to take some of your online classes, because I'm very much of a 1 or 2 hours a day kind of process it, then another 1 or 2 hours a day the next day. When you go to like the intensives, I'm like, I forgot what the first day was, because I'm on the last day and I've just forgotten everything. And so appreciate you're doing some
Yeah.
online recordings. It's really great for my learning style.
Yeah, I thought so too. And, you know, because it's so much information coming at you so fast, you know, and in that 12 hours, and there's so much more I wanted to say. So this gives me the chance to slow down and really cover a gene thoroughly, you know, a gene pathway thoroughly. So I enjoyed it too. And I think it's great. Yeah, you're right. It's like you can do a couple hours at a time and then, you know, take notes and absorb it. And then when you're ready for more, go back for more. So
Yeah,
that's cool. I'm glad you like
awesome.
it.
Let me then just pause. I would love to do another one of these and just think of more questions for you, but this has been a very pleasant hour of just chatting and kind of picking your brain, and it's really been wonderful. Thank you for doing this with me.
Oh, you're sure welcome, Louis. It's nice to see you, and I'm glad you're tiptoeing back in and getting it going. And let us know how we can support you.
Yeah,
We're
I've
there.
I've been kind of, some cases come in and they're kind of like a crisis, like this is an acute chemical problem, versus I would enjoy working more with chronic
Yeah,
genetic kind of tendency problems, because those are so frustrating.
yeah,
But occasionally someone's just like, just broke my leg, what nutrition do I need to speed healing?
yeah,
That's different.
yeah. It
So
really is.
Dr. J, thank you so much. I will see you on your recordings as I continue your classes. And I just wanted to again say, if someone wants to learn a little bit more, they can go to myhappygenes.com. Correct?
Hmm.
That's probably the best place to start.
Yep.
Is there a place where someone
Yeah.
could find a doctor, like call you or something and say, you could say, or find a doctor in your area that knows this stuff?
Well, there is, and it's on holisticmethylation.com. You're probably going to have to spell that for people, but
Okay.
it's
I will,
holistic with a W.
uh-huh.
There's the referral list is on there for all around the country. We have around 500 doctors now on there. And eventually, you know, as people get certified in My Happy Genes, we'll be putting them on there
Good.
as practitioners. So
Great.
that's coming.
Awesome. I know people like to kind of keep it simple. Where can I find somebody that does this? And I like to,
Yeah.
you're very good at taking complicated subjects and kind of saying, I'm the guy that's in the back of the class going like, just tell me what to do. What do I do?
I don't want to know the details. Yeah.
All this
Well, that's
theory.
what you'll probably. Well, you'll probably really like My Happy Genes because the machine does it all for you. It calculates all that stuff and then spits out these are the supplements you need to give your patient. So
Yeah, awesome. Awesome. Well, again, I could chat for more, and probably will invite you to like do another one of these in the future. But thank you very much for your time, Dr. J.
you're welcome, Louis. Good to see you.
Okay. Good to see you too. All right. I think, Dr. J, I ended the recording, and basically that's it. I just had the most wonderful time seeing you and interacting with you. And I felt like I somehow managed to go to the front of the class and be able to just chat with you, which is
That's,
really awesome. Thank you for sharing your time.
you're most welcome. No problem.
Okay, well, I'll stay in touch with you, probably with the little comments that keep happening with the class where you ask things after each lesson. And thank you for your feedback. It's fun to kind of hear a little bit from the course creator.
Yeah, you bet. And we have one more live session coming up. You probably saw the notification on that. Or?
I haven't, but I will go check it out because I would like to participate in the live session.
Okay, I think it's December or something, but we'll be sending out a reminder of it.
Okay.
So.
Awesome.
And
Awesome.
if
I
you
can't
can-
wait to participate.
Okay,
Okay.
we'll see you then. All
Stay
right.
happy, stay healthy. I'll see you again on another time. Bye-bye.
Okay, good to see you, Liz.